The health and well-being of faculty and staff is a priority at Ohio State. All of the benefits available to you reflect Ohio State's commitment to provide high-quality, affordable plans and represent a significant component of your total rewards. The university-sponsored medical plans provide comprehensive coverage and wellness benefits for you and your eligible dependents. During this presentation, we will discuss the medical plans offered so you can choose the plan that best matches the needs of you and your family. The Ohio State University Health Plan manages the healthcare benefits offered to university faculty and staff. Enrolling in Ohio State benefits administered by the health plan means gaining access to not only a robust provider network, but also a wide variety of health and wellness programs, benefits, and tools. Luminaire Health manages claim processing, inquiries about claims, medical ID cards, and continuation of health coverage through COBRA. Luminaire Health provides claim information via the Luminaire Health app or their self-service website at myluminairehealth.com, or you can reach them by phone at 866-442-8257. In this section, we'll discuss how to view your digital medical ID card, view your claims details online, and use the Luminaire Health platform to stay informed about your benefits and account activity. Let's get started by exploring the tools and resources available to you. After you complete the medical plan enrollment process in Workday, a medical ID card will be mailed to your home address from Luminaire Health. You should expect to receive your medical ID card approximately 2 weeks after you enroll. To view or print a digital copy of your medical ID card, you may go to the Luminaire Health self-service site at myluminairehealth.com. For first-time users, you will need to register and create an account. To register your account, you are required to input specific information, including your Social Security number, last name, zip code, and date of birth. To access your digital medical ID card through the Luminaire portal, select My Links, then See My ID card. The Luminaire portal is also available to make it easier for you to access your medical claims information by allowing quick access to view claims and the status of your deductible and out-of-pocket maximum. Also, you may ask questions and receive answers from Luminaire Health through the Message Center. To view your claims and explanation of benefits in the Luminaire Health portal, navigate to the My Claims section, which is located at the top left of the screen. Here, you'll see a summary of your recent claims, including the dates of service, provider, and claim status. To view detailed information, click on a specific claim and View Details. This will allow you to see a full explanation of benefits, including the amount billed, the portion covered by insurance, and any out-of-pocket costs. Ohio State offers a range of medical plan options to meet the diverse needs of our employees and their families. In this section, we'll provide an overview of the plans available, including key features and considerations for each. Ohio State's medical benefits provide you with comprehensive coverage for planned and emergency care. Each plan's provisions vary, so you have flexibility when deciding which option is right for you and your family. All of the medical plans provide coverage for the same type of medical services. However, the employee expense for each plan varies based on how the plan pays for those services. When selecting a plan, think about how frequently you visit the doctor, whether you need out-of-network coverage, and how you want to balance your employee contribution rates with what you're required to pay out of pocket for medical services. All Prime Care plan options have two networks available, the Premier Network and the Standard Network. While members can choose providers from either network at any time, those utilizing Premier Network providers will receive the highest level of benefit coverage. The Premier Network provides a higher level of benefit coverage. You pay a lower coinsurance, meaning the health plan covers more of your out-of-pocket expenses, and fewer services are subject to the deductible, meaning you start saving right away. The Standard Network offers a lower level of benefits compared to the Premier Network. You'll have to pay higher coinsurance, leading to more out-of-pocket expenses, and more services are subject to the deductible, meaning you will need to cover more upfront before the plan starts to pay. By choosing providers within the Premier network, you maximize your benefits and minimize your out-of-pocket expenses. The Prime Care Advantage medical plan requires that you receive medical care from a statewide network of providers. Non-network services are not covered under this plan except for emergencies. The plan requires an annual deductible and coinsurance for many services. The plan pays 100% for preventative care and convenient care visits, such as the Minute Clinic and Premier Network PCP office visits. The plan pays 80% coinsurance for Premier Network providers and 70% coinsurance for standard network providers. Most services are also subject to a deductible before the plan begins to pay. The annual deductible is $550 for an individual and $1,100 for a family. Behavioral health office visits, urgent care visits, as well as Premier Network specialists are subject to coinsurance but no deductible. All other provider office visits are subject to the deductible and coinsurance. Inpatient admissions, outpatient surgeries, and lab and x-rays are also subject to the deductible and coinsurance. The annual out-of-pocket maximum is $3,000 for an individual and $6,000 for a family. The Prime Care Choice plan has lower employee payroll contributions when compared to Ohio State's other medical plans. Prime Care Choice has in-network and out-of-network coverage for medical services that are typically subject to a deductible and coinsurance. When using Premier Network services, you receive contracted rates and the highest percentage of coverage by the medical plan. Comparatively, when you use standard network providers, you still receive contracted rates but are covered at a lower percentage. When you obtain services outside the network, your claims can be subject to balance billing and you receive the lowest level of coverage. Most services are subject to the deductible and coinsurance, except for in-network preventative care and convenient care visits, such as the Minute Clinic and in-network PCP office visits, which are covered at 100%. The plan pays 80% coinsurance for Premier Network providers and 70% coinsurance for standard network providers after you have met the deductible. The annual deductible is $975 for an individual and $1,950 for a family. The annual out-of-pocket maximum is $4,350 for an individual and $8,700 for a family. When using an out-of-network provider under Prime Care Choice, your out-of-pocket costs will be higher than if you use in-network providers. If you use an out-of-network provider, all services are subject to the deductible and coinsurance. The plan will pay 60% of the allowed amount for medical services received, and you will be responsible for paying the remaining 40% of the costs and charges above the allowed amount. The only exception to this is emergency care, in which case the plan will pay 80% after the deductible is met. The annual out-of-network deductible is $1,900 for an individual and $3,800 for a family, and the annual out-of-pocket maximum is $7,500 for an individual and $15,000 for a family. The Prime Care Connect benefit option is designed for those with limited household income and intended to eliminate some of the financial barriers to obtaining necessary health care. The premium rate is the same as Prime Care Advantage. Savings are realized through lower out-of-pocket cost due to reduced deductibles, copayments, and coinsurance. In order to be eligible for Prime Care Connect, you must be a full-time Ohio State employee with an FTE of 75 to 100% who is eligible for full-time medical contribution rates, and your household income cannot exceed 225% of the federal poverty guidelines. A special application is required to participate in Prime Care Connect, and current enrollees must reapply each year. To get your application, contact the OSU Health Plan at 614-292-4700 or download an application from the OSU Health Plan's website. If you want to ensure medical plan coverage through Ohio State, you should enroll in one of the other medical plan options while your application for Prime Care Connect is being processed. Enrollment into Prime Care Connect will automatically be updated if your application is approved. Now we will highlight how some medical services are covered under the Prime Care Connect plan. Prime Care Connect has a deductible of $150 for an individual and $300 for a family. The annual out-of-pocket maximum is $1,500 for an individual and $3,000 for a family. For services that are subject to coinsurance, the plan will pay 85% for Premier Network providers and 75% for standard network providers. Preventative care, convenient care, behavioral health office visits, and Premier Network PCP office visits are covered at 100%. The copayment for a standard network primary care office visit is $20. For Premier Network specialists and other practitioners, the office visit copayment is $20 and $30 in the standard network. For urgent care, the copayment is $35, and emergency room visits have a copayment of $100. The out-of-area plan is available only to employees who live in areas without adequate network access, and plan eligibility is determined by your zip code. Temporary access to out-of-area coverage is available to individuals enrolled in Prime Care Advantage, Prime Care Choice, or Prime Care Connect who reside in qualifying zip codes outside the network area for at least 30 consecutive days. Temporary out-of-area coverage may be elected or renewed by submitting a paper form or by completing the temporary out-of-area medical coverage application/renewal via the HR Connection portal. Please note, applications must be renewed annually. In the out-of-area plan, all services except for preventative care, PCP office visits, and convenient care are subject to coinsurance. Most services are also subject to a deductible before the plan begins to pay benefits. The annual deductible is $550 for an individual and $1,100 for a family. For behavioral health office visits, the plan will pay 80% after the deductible has been met. All other provider office visits are subject to the deductible and coinsurance. For convenient care providers, the plan will pay 100% for a visit. For urgent care visits, the plan will pay 80% after the deductible is met. Inpatient admissions, outpatient surgeries, and lab and x-rays are also subject to the deductible and coinsurance. The annual out-of-pocket maximum is $3,000 for an individual and $6,000 for a family. Enrolling in Ohio State benefits administered by the OSU Health Plan means gaining access to a wide variety of health and wellness programs and services. In this section, we'll provide an overview of the programs and services offered to OSU Health Plan members. For more detailed information, visit the Programs and Services drop-down menu on the OSU Health Plan website. The OSU Health Plan Dedicated Support Team is comprised of dedicated customer service specialists who are specifically trained not only to answer your health care benefit questions, but help guide you through the complexities of claims, coverages, and scheduling. Personal health coaching is a complimentary service for benefits eligible Ohio State faculty and staff. Adult dependents on the OSU Health Plan are also eligible for these programs, complements of your plan for health. You will work with your coach to develop an action plan and strategies personalized for your specific health needs. Your coach will support you through regular phone sessions and, when needed, connect you to community resources to assist in your journey to better health. The Buckeye Baby Program offers support to expected parents from early pregnancy through delivery and postpartum. All services are complimentary and confidential for those who have Ohio State medical benefits. The Care Coordination Program is for members with chronic conditions such as asthma, diabetes, COPD, or heart disease. It provides an action plan, access to healthcare professionals, and the value-based prescription drug plan, which offers reduced copayments for certain medications. Prime Access allows Ohio State Health Plan members to schedule new healthcare provider appointments in a more timely fashion, in most cases within 2 to 3 weeks. When you're looking for a new doctor, let Prime Access go to work for you. Getting and staying healthy starts with knowing your body's biometric numbers. Biometric health screenings include height, weight, blood pressure, and other values to measure heart health and blood sugar levels. Biometric health screenings are complimentary to all OSU benefits eligible employees and their enrolled spouses. You can obtain biometric health numbers by visiting your primary care provider or by attending a complimentary on campus screening. Screenings are non fasting and held throughout the year. The EAP program offers many everyday resources to help make your life a little easier and less overwhelming, including 5 free counseling sessions to faculty, staff, their household members, and parents-in-law. The program also offers resource locators to help find child and adult care, tools to improve your financial wellness, legal services, travel and entertainment planning assistance, support to find cleaning services, on demand professional development courses, and much more. For more detailed information, please visit our website at hr.osu.edu. If you have questions regarding your benefits, you can submit a question to the HR Connection portal at hrconnection.osu.edu, email HR Connection at hrconnection@osu.edu, or call HR Connection at 614-247-6947.